Well, there really isn't another website that really goes deeply into cancer-related problems with sexuality and fertility, and we cover both men and women and across all cancer sites and types of treatment. So that in itself is unusual. I also came out of the MD Anderson faculty, and we had 3 grants from the National Cancer Institute that helped us develop our content. And so that meant we could actually test it out in several clinical trials and show that our self-help tools that we develop for patients actually have good outcomes and increase patients' sexual satisfaction and function. We also added a new element called our professional portal that's geared to healthcare professionals, because I know that there is so much pressure to talk about so many things in busy oncology clinics, and physicians and nurses get often very minimal training in how to manage sexual or fertility problems, so they feel anxious and worried when the patient brings it up, and they fail often to bring it up themselves. And that was one of the reasons I created this whole website, was to make sure that patients could get timely, accurate information 24/7. That's the great thing about the internet. But our professional portal actually includes a whole section with online skills training that talks about the different professions that might be using it and what their strengths and areas of needing new learning would be, and some tricks of the trade of how to make it a lot easier to talk about sexuality. And we have a really detailed clinician's manual for people who are actually doing counseling and would like to use our self-help sites with patients, how to do that optimally and how to troubleshoot if things, if things aren't going well. I think the video stories are very helpful, because even patients who go to support groups tell me that sometimes topics like sex or fertility don't get openly discussed. And everybody's sitting there thinking, I'm the only one that has this distress or this problem. So I think that the patient's stories help patients feel less alone. They also are a great teaching tool for clinicians, because each of the interviews that I did with patients, and there are 7 or 8 in the male version and in the female version, is a different kind of cancer, a different kind of case, and they see me getting the patient to open up talking about their problems, and that in itself may be helpful. We also recorded some vignettes with actors just to show real life situations and how communications within a couple, for example, often develop, or the dilemmas they face, and we show examples of helpful communication and not so helpful communication.